Hello, this is Dr. Phil Davies speaking to you from my practice in Hampshire. Now we're doing a series of videos largely for our practice population but also for the wider UK population, and these videos are there to educate people in how to prepare and get through the COVID-19 pandemic. Now we've set up a website called thevirus.uk, and on the front page of that website there are links that are useful. One is linked to video advice for the elderly, and another link is video advice for the young. This particular video is targeting younger adults. Now it's worth knowing that younger people tend to have an easier course through this infection compared to the elderly, but that's not universal. Certainly very young children mostly have a very mild course. They do seem to get it. Mostly they have a benign course. Young adults though can get a severe viral infection. The way it presents is usually with a persistent dry cough and a fever. There are other features that can affect young people. The loss of the sense of smell and sense of taste seems to happen perhaps 30% of the time as well. Other things like muscle aches and extreme energy loss and some headache and sore throat, that can all happen also. But generally speaking, a persistent cough and a bit of a fever, you don't need to phone a doctor in that case. But this is a respiratory illness, so it does affect the chest. And if you start having breathing difficulties, you do need to phone for medical advice. Young people can go downhill very quickly with this illness. So, should you find yourself in a situation where you feel there is some breathlessness coming on, perhaps the sort of activities you normally do quite easily are starting to become a little bit tricky due to breathing issues, then you need to phone. And who would you phone? NHS 111. So that's dial 111. Now, it could be that your general practice offers an out-of-hours service or an in-service on-call GP, in which case you can phone them also. We ourselves are looking to expand our cover for 24/7 for our patients. But until that is in place, patients should dial 111. Obviously, in an emergency, it's 999. And when they dial 111, the medical professional on the end of the phone is going to want to know some things from you, and primarily it would be, do you feel any breathlessness? Are there things that you would normally do that you now find are causing a bit of breathlessness? Do you speak in full sentences without having to stop to breathe heavily? What's your respiratory rate? What's your pulse rate? Our previous videos that you can link to show you how to effectively measure them and record them when you're well, and then record them again when you're unwell before you phone the medical professional. A further thing we covered in one of our videos was the Roth score, developed in Israel. Now it has been a bit discredited recently, and so therefore on its own it's not a particularly useful test. This is the test where you take a deep breath and count towards 30, and we measure which number you get to before you have to stop and breathe, and we measure how long you took to get there. Now that test on its own is proven to be not particularly reliable, but it could be useful if you know you're reading now when you're well, and then we can measure it when you're unwell, and that difference could be important. If you've lost 20% of your capability, then I think it's starting to be significant. If you've lost 30% of your capability, it's particularly significant. If you normally counted all the way to 30 before having to take a breath, and now you can only get to 20, you do need to be seen face to face at the very least. So the Roth score will still be a useful adjunct to use. Obviously, if you are an asthmatic, then we would like to know your peak flow, and this is a peak flow meter that you should have. Know what your readings are when you're well, and then we can compare that to when you're unwell. If you're a diabetic, we'd like to know your blood sugar. If you've got a blood pressure machine at home, yeah, we'd like to know your blood pressure as well. Those are the sort of things that we'd like to know from you. And we can then make up our mind whether you're appropriate for sending straight to hospital, or you need a face-to-face assessment, or perhaps you're actually good to go and stay at home. If your respiratory rate is under 20 and your pulse rate is nicely under 100 and your Roth score is 30, yeah, I think in most cases we'd probably keep you at home, but we'd follow you up regularly. So practice those readings now so that you're prepared for when you do get unwell. Hopefully not. Thanks.